Now, just a
Exactly.
quick question. So many people, if they hear this, like they might be a bit confused on why it's not helpful to be positive. Because, like that's something that people always try and do, right? Just, like be positive, like something is, or like if something happens in your life that's not good. So just to zoom in on that, why is it not helpful to be overly positive? How does it make the trauma survivor feel?
That's a great question. And it is tricky because obviously there's research that optimism is a helpful characteristic psychologically overall. There is good research on that. When work, this comes to the idea that trauma-informed work in psychotherapy is a subspecialty. It's not exactly the same as doing regular psychotherapy. Most of the principles of regular psychotherapy, yes, do hold, the majority. But then there's a subspecialty or a sub area of skills that trauma therapists need to know. And this is, and you've hit the nail on the head on one of the most fundamental aspects, which is that with trauma survivors, for them to feel safe, to be able to explore a variety of complicated mixed feelings, they first need to know that you validate their experience, that you get it, that you're listening, that you don't minimize their experience, um, that you hear them, that they have suffered. And this can be tricky, especially if the therapist feels as if the patient is making a big deal out of nothing, whining about things that they wouldn't feel would be a big deal, et cetera, et cetera. So you might say, well, what kind of therapist would do that?
Mm-hmm.
Well, therapists are human beings. And everybody gets triggered by something, and therapists are included in that. And so I give a nice example in my most recent book, Trauma and the Struggle to Open Up, about a situation where somebody loses their dog. Their dog dies. And some therapists might minimize the experience of the loss of a pet. They might not view that as traumatic. And I'm not trying to say that in the world of trauma comparison, losing a pet is equivalent to other kinds of traumas. I mean, trauma survivors do this all the time. Is my trauma worse than yours? When they're in group therapy, it sometimes becomes a challenging thing because people compare their trauma experiences, and that can be a real challenge. But at the end of the day, when you're actually working with people in therapy, it's very important to take their suffering seriously. Not to get into this, whose trauma is worse than whose trauma. People will say, oh yeah, I just lost my pet. Look, I mean, there are people who are refugees from Syria, and they're the ones who've really suffered. Why am I sitting here? Trauma survivors themselves might invalidate their own experiences and say, I don't deserve your time and your specialty and your whatever. I'm just an idiot who lost his dog. What's the big deal? They might say to themselves, or they might even say it out loud. I've had clients say things like that to me. And I will say to them, look, I'm not here to compare whose suffering is worse. That's not my job. Sure, there always are people who've suffered more than you. But when you tell me the story, what I'm hearing is that this pet of yours was your best friend. And when I think about the idea of losing your best friend, no, that's not a small thing. That's a big deal. And if you're feeling depressed about that and you're suffering and you don't know what to do and you're finding yourself still struggling even months later, that's something we need to take seriously. And so
Got it.
I'm not sure if I answered your question though, or if I sidetracked myself.
No, that's fine because like you did mention quite a bit there, but like we will cover all that because like you talk about in the book how you have like different ways to approach like therapy and just like really help the client feel comfortable.
I know, but you asked about toxic positivity. And why is that a problem? Because at the end of the day, when people jump to the idea of being too positive too quickly, what they've done is they leapfrogged over validation. And so what happens is if somebody says, well, right, no, I understand you lost your pet. Look, at the end of the day, you can always get another pet. And at the end of the day, it's not like you lost your family member. So what ends up happening is they're trying to be helpful, And what the trauma survivor feels, so let's define that person as a trauma survivor, if they themselves are really suffering because of that loss. That trauma survivor would literally just feel foolish. And they might even say, yeah, you're right. I don't know what's gotten into me. I'm making a big deal out of nothing. But deep down, they just feel foolish and ashamed of themselves. It actually makes things worse. It actually makes things a lot worse, actually, when people invalidate. Because then what they feel is not just the suffering for what happened, but foolish for having that suffering. And so it's really actually quite problematic. And so what has to happen is first the person has to feel that they have permission to feel whatever they feel. And if that's loss of a pet and that's depression because secondary to that, okay, so then that's what that is. You work with them where they're at. You actually listen to them and follow their lead and work with them through that. And then you see where they go. And what ends up happening is that if you listen to what they're going through, there's a natural desire. Nobody wants to stay in their trauma forever. That desire to be able to come out, to be able to see light, to be able to move forward, to be able to find a future, that part of the person is there. It just takes a while for that to come out. And then when that does, you can help them move forward, but you just have to be patient. You can't jump to that too quickly.
God, yeah. So it just pretty much makes the person feel like they haven't been heard, right? And then you mentioned that this can pretty much lead to them even telling themselves, oh yeah, like it's not even a big deal. Like, why am I sad? Like, why do I feel this way? Because they've not been validated, right? Which is not a healthy way to cope, right? So